New federal data show Affordable Care Act enrollments are down nearly 3 million from last year. Premiums jumped at the start of 2026 after Congress let COVID-era federal subsidies expire. Dr. Céline Gounder joins us to discuss. Dr. Gounder, always good to have you on the program. Talk about the relationship here between premiums going up and enrollments going down.
Well, for 4 years, federal subsidies capped what people paid for their coverage, and those enhanced tax credits expired January 1st. This is what that government shutdown last fall was all about, was a fight over these tax credits. So overnight, the average payment jumped by about 58%, and deductibles rose by about $1,000. So more than 90% of enrollees had help. And now that that help has vanished, many cannot afford their plan.
Okay, so they're no longer covered. That does not mean, however, they no longer get sick.
I wish it worked that way, right? But unfortunately, when people can't afford health coverage, they also are very much at risk for not getting care on time. A lot of people will delay, they'll show up later and sicker, which also means probably more expensive. And my colleagues at KFF found that even among those who renewed their insurance, 73% of them worried about being able to afford a hospital stay. So that's despite having signed up for insurance. People are really, really worried about the costs of health insurance.
And we've discussed this before, Dr. Gounder, but it's worth reminding my audience. Insurance, in whatever context, is a pooled entity. And when healthier people get out of the pool, that means sicker people are still there, which means there could be higher insurance premiums even later this year, if I understand that correctly.
Yeah, it's what experts call the death spiral. So as people leave the health insurance marketplace because maybe they're healthier and they don't think they really need it, in general, what ends up happening is you have people who are sicker and costlier who stick around, and then the insurance companies increase their rates because those people who are left, you have a concentration of risk. And then because the rates go up, even more people leave. So that spiral continues. And the way the Affordable Care Act was originally written was to prevent that kind of spiral from happening. But over the years, different aspects of that have been chipped away at, and those protections are no longer there.
So Congress let these expire, Dr. Gounder. That means Congress could, if it changed its mind, reinstitute them at some level. And as I understand it, New Mexico is a state that offers some clarity about what happens if you sustain these subsidies.
That's right. So there's a Senate proposal from Susan Collins and Bernie Moreno, so both Republican senators, who would restore the credits for 2 years. That proposal is getting bipartisan support. And as you say, there is proof that this works. When you make health insurance more affordable for people, they are more likely to enroll. In New Mexico, they replaced the lost federal subsidies with state money. It's the only state to have done this, and it's the only state where enrollment rose.
Dr. Céline Gounder, always a pleasure. Thank you.